Let's start by thinking about what the breasts actually consist of. Breasts are made up of lobules, which are the milk-producing glands, and also ducts, which are the tiny tubes that take milk from the lobules down to the nipple when breastfeeding. And these are surrounded by glandular, fatty, fibrous tissue. The breasts extend up to the collarbone and under the arm, and sort of resemble a kind of fish shape. Sometimes cells within the breast can alter and look different under a microscope, and they behave in a way that's not like normal cells. They have the ability to invade into the surrounding breast tissue and also to travel to other parts of the body. Breast cancer isn't one disease. There are many different types of breast cancer, and it can affect any part of the breast, including the nipple area. We don't know the actual causes of breast cancer. There's not one specific cause, and it's probably a combination of lots of factors. However, we do know that there are three main risk factors for developing breast cancer. These are being a woman, getting older, and for a very small proportion, having a significant family history. Women get breast cancer, but men can also develop breast cancer. Breast cancer is the most common cancer in the UK, with around 50,000 people being diagnosed each year, and that includes 400 men. It doesn't matter what your ethnic background is or your social background is, we're all at risk. Women are obviously at much more risk than men. About 80% of women who are diagnosed in the UK are over 50 years of age. Unfortunately, you cannot prevent breast cancer. What you can do is help reduce your risk of developing breast cancer through living in a healthy way. Things like drinking alcohol but only within the recommended guidelines. Things like taking regular exercise and maintaining a healthy weight. This won't prevent breast cancer, but it may help reduce your risk. The sooner breast cancer is diagnosed, the more effective treatment might be. So what we do recommend is that people are breast aware. Being breast aware just means getting to know the look and the feel of your breasts as you go through your life. We're all different, and breasts change depending on where you are in your life. They're very different at puberty, going through pregnancy, and then on to the menopause. Breast awareness is about getting to know what's normal for you as an individual, so that if you detect any changes, that they can be taken and reported to your GP without delay.
Well, first it's important to know what your breasts normally look and feel like. A lot of people tell us they're not sure what is normal for them, so if that's the case, then spend the next month or two getting to know what your breasts look and feel like. A lot of women notice, for example, their breasts have lumps and bumps, and that's normal for a lot of women. A lot of us also might have one breast bigger or of a different shape to the other, and that can also be perfectly normal. It is important to know what's normal for you, what your breasts normally look and feel like, because it makes it easier to notice any new changes. If you notice a change that is not normal for you, then it's important to speak to your GP about it as soon as you can. Most breast changes are not breast cancer, but they should be checked with somebody just in case. Some of the things you should be aware of include any changes to the size of the breast, if one breast became bigger than the other or changed shape, any lumps that you've not experienced before, or if the nipple goes inwards when it's always been out. Things like that. Those are just examples, and there is more information in our leaflets about things to look and feel for. There is no specific way to be breast aware. What's important is to find a way that is comfortable and convenient to you. Being breast aware means getting to know what your breasts normally look and feel like. And you can do this as part of your normal routine. So you can do it when you're showering, putting cream on, getting dressed, bathing, getting ready for bed. So it can be just part of a normal routine. What is important is to both look and feel, if you can, and if you feel comfortable, to look in the mirror, as you might see things that you wouldn't if you're not looking in the mirror. It doesn't have to take very long, but it is important to be breastwear regularly. How often is up to you. When we ask, we would say every 40 weeks, 6 weeks. We do encourage men to check their chest area as well, as men have breast tissue and can develop breast cancer. And when we mean being breast aware, we mean checking the whole breast tissue. And what we mean by that is the breast, but also up to the collarbone, underneath the armpit, and underneath the breast. So you're checking the whole area. The breast screening program invites women for a mammogram. That's where 2 x-rays of each breast are taken. Breast screening is a way to detect breast cancer early, and it is important because, generally speaking, we know that the sooner breast cancer is found, the better. It generally means that treatments are going to be simpler and more effective. So the main benefit of breast screening is that it can spot breast cancer before people experience or find any symptoms. Now, breast cancer screening is not 100% effective. There are limitations with it. When you receive your invitation, you will get a leaflet explaining to you in detail what is good and bad about breast screening. So it's important that you read this leaflet so you have all the information you need to understand what's involved with breast screening. If you need more information, you can speak to your GP or the breast screening unit that's invited you, or you can even contact us, charities like ourselves, like Breast Cancer Care, for more information. Breast screening does not prevent breast cancer, so it is important to continue being breast aware in between screenings. So breast screening is offered to women aged 50 to 70 who are registered with a GP. It happens every 3 years, and women get a letter which invites them to a specific location with a specific time and date, which they can change if it's not convenient for them. There are plans to exchange the breast screening program, so in the next few years it will be offered to women aged 47 to 73. Women over the screening age are still at risk of breast cancer, and they can ring to request an appointment. So when you go for your mammogram, you will be asked to take off your top and your bra, and you will have access to a changing room to do that, and all the staff there are going to be women. What will happen is they will take 2 x-rays of each breast, and to do that they will compress the breast for a few moments. Some women can find this uncomfortable or painful, but it only lasts a few moments, and you can speak to staff if you find it painful. People often think that if breast cancer is not in their family, then they don't need to be breast aware, they don't need to know about it. But that's not true, because there's only a small percentage of breast cancer that are linked to family history. So for that reason, everybody should know about breast cancer. People often hear about things that might increase their risk of breast cancer. They worry about their lifestyle. And as we've said, there's little information about what causes breast cancer. But if you have any worries, then it's important to speak to your GP or get more information from charities like ourselves.